Hello everyone. In this podcast we're going to talk about one of the most common issues that concern parents, which is how on earth am I going to persuade or make my child wear their glasses? Well, the simple answer is you're not. You're not going to make your child wear them. You're not going to persuade your child to wear them. What you're going to do is encourage your child to appreciate their glasses and leave the rest up to them. It's really simple, but there's an awful lot that we have to go through to convince you. So, first of all, let's think about why we prescribe glasses for children. We prescribe glasses to allow them to see better, and that means, of course, that they will learn better, or to make them more comfortable in using their vision. Think of a pair of spectacles like an overcoat. Now, if you go into a shop and buy your child an overcoat, you don't expect the assistant to tell you your child has got to wear their overcoat all the time. That would be nonsense, wouldn't it? It's exactly the same with spectacles. There is almost never a reason why a child needs to wear their glasses all the time. But parents are frequently told when they're issued a prescription, they're for full-time use. Your child needs to wear their glasses all the time. And what that does is make you feel guilty. You feel like a bad parent if you've got a 3-year-old and they won't wear their glasses as they're supposed to. And worse, you feel afraid that if your child doesn't wear their glasses, something terrible is going to happen. Their eyes are going to get worse, their long sight or short sight is going to get worse, or heaven forbid, they're going to go blind if they don't wear their glasses. All of that is just nonsense. There's no evidence whatsoever that glasses make your child more or less long-sighted or short-sighted. Short sight and long sight are generally caused by the eyes growing too much or not quite enough. And that growth, as far as we know, is not influenced by whether the child has glasses on their face or not. So if your child is going to get more long-sighted, wearing their glasses is not going to make any difference. But what the glasses are going to do is allow your child to see clearly and to learn, play and interact with greater comfort. So glasses are important, but just like an overcoat, they're only important when you need to wear them. You need an overcoat when it's cold outside. So you need your glasses when you need to see clearly. So in school, watching television or whatever, depends on whether your child is long-sighted or short-sighted. There's certainly no need for them to be worn all the time. There is actually an exception to that. If your child has a squint, and most squints in children with Down syndrome are one eye turned inwards, and that squint is straightened completely by their glasses, and that's not the case in all children with a squint, then there may be a reasonable argument that that child's better off wearing their glasses all the time so that the squint doesn't get consolidated and straight eyes becomes the norm. But even if your child is only wearing their glasses for part of the time, so sometimes they've got a squint when they haven't got their glasses on, and when they put their glasses on they haven't got a squint, they're still better off than they were before they went into glasses. So even wearing your glasses for a short time is a good thing. And while we might want the ideal, which is wearing their glasses full time, eventually we'll only get there if we get the child on side. And that's what this video is all about. So I just want to tell you about one piece of research that's been done. This was a fairly recent study within the last couple of years, and was the only occasion when a research study was done into children's compliance with spectacle wear. So it was a fairly small study. 38 children, typical children, were issued with spectacles at the hospital eye clinic. Now these were children who needed to wear spectacles because they had poorer vision in one eye than the other. And just out of interest, that condition is much more common in typical children than it is in children with Down syndrome. Isn't it nice to know that children with Down syndrome are at less risk of some conditions? You don't usually get told that, do you? But nevertheless, these typical children all had poor vision in one eye, which we call a lazy eye, which is a condition that a term that we shouldn't use, because it sort of puts the blame on the child, doesn't it? Because lazy is a derogatory term. So telling a child they've got a lazy eye makes it sound like their fault when it isn't. But leave that aside, otherwise I'll just go off into a huge rant about how we discuss things with children. So this really important issue about this study is these children were issued with smart specs. Their spectacle frame had a sensor on the side that responded when it was in contact with their skin, and a little computer chip inside recorded the length of time those spectacles were on the child's face. So the researchers could get an actual monitoring of spectacle wear as opposed to parental reports, because parental reports can be unreliable, can't they? Okay, if you've been told that your child has got to wear their glasses all the time, and you're really struggling to wear them for more than 5 minutes at a time, and the hospital staff are making you feel like a dreadful parent, then you're quite likely going to lie, aren't you? So this was a way of getting round that issue and recording the actual time the children wore their specs. And the results showed, or in spite of being told that they had to wear their glasses for all waking hours, not one single child obeyed that instruction. The child who wore their spectacles most wore their specs for 95% of waking hours, but every other child was less, covering every possibility, down to one child who wore their spectacles for 10% of waking hours. So, if typical children don't wear their glasses all the time, why is anyone expecting your children to wear their glasses all the time? And however little your child is wearing their glasses, they are behaving like a typical child. So the really important thing is not to worry about it. And particularly, don't fret. If your child decides to take their shoes and socks off, you don't get worried, do you? So if they decide to take their specs off, don't worry about it. If you fret about it, then the child is going to pick up on your anxiety, and he or she will associate spectacles with a negative experience, your distress. Oh, I don't want to put those on because mummy gets upset when I do, so I won't put them on. All right, so the really important thing is don't fret. Now, if you are currently, as you listen to this, in the situation where you've been trying for ages to get your child to wear their specs and they're refusing, and you have been anxious about it, put the specs away for a couple or even a few weeks. Let everything calm down, let your child forget about it, and then start again when everything has blown over. Okay, so far so good. So, the first thing when we think about why children take a long time to get used to wearing specs is to imagine how specs appear to the child. Now, there are lots and lots of good reasons why a child doesn't want to wear their specs. And when we understand what they are, we'll have a bit more sympathy with them. First of all, are the specs fitting well? If they're hurting your child, rubbing them behind their ears or pinching their nose, obviously they won't want to wear them much. The same goes if their specs are falling down their nose all the time, so they're constantly doing this. So the first thing is just to know that your child's spectacles fit properly. Okay? Then specs can feel a bit odd when you first put them on. I don't know if you remember, if you wear glasses, what they felt like when you first put them on, but I used to get a really itchy nose just here when I started wearing glasses when I was 11. I remember that really, really clearly. And then, of course, there are some children who absolutely hate anything near or on their face. They have what we call hypersensitivity. You'll know if you've got a child like this, because this will be a child that refuses to wear hats, grips in their hair, scarves. Haircuts are a nightmare. So obviously trying to put something hard on their face is going to be extremely challenging, and we'll deal with those particular children separately a bit later on. The other thing is, of course, that in spite of spectacles being designed to make the world look better, in doing so, of course, they make the world look different. If you're short-sighted or long-sighted, the world looks blurred, but of course to you that isn't blurred, that's just what your world looks like. So if we make that world clear, the average child will just think, oh, that's different, oh, don't like that much. Particularly if you're the sort of child that doesn't cope well with new things, with change. So it does take a long time to get used to that. But in addition, spectacles have distortions. To begin with, they magnify or minify. So here's one of the lenses from my glasses, and look what they do. They make everything look much smaller. So when I put my glasses on, because I'm short-sighted, everything looks clear, okay, and I'm used to that and I quite like it. But everything also looks smaller. I don't have a pair of specs for long sight because I'm short-sighted rather than long-sighted, but I have got a magnifying glass which has the same effect. So glasses for long sight make everything look bigger. So the world looks different in a number of ways, and when you make the world look bigger or smaller, it becomes difficult to tell where things are. If things look smaller, you think they're further away. If things look bigger, you think they're closer. So the child might put their glasses on and go to pick their cup up, and they miss it. And obviously, I want to have a drink. I don't want things looking like they're where they're not, so I'll take my glasses off. Also, all spectacle lenses have distortions around the edges. So when you look sideways through the edge of your lenses, you see things a bit distorted. And you may be aware that when you first started wearing spectacles, doorways looked curved, or tables looked as if they were coming up towards you or dipping down away from you. And again, that takes a little bit of getting used to. So we can understand now why children don't want to wear their glasses all the time, and they take a long time to tolerate wearing them for even a short time. So what we're going to do now is talk about how to encourage your child. So your child has just been prescribed spectacles, or you've put those spectacles away for a couple of weeks and let the child forget about them. So we're starting from scratch. Let's start with children who have hypersensitivity of their head and face. Now, if this is not your child, then you can skip this bit and go on to the next bit, to stage 2. If your child is hypersensitive, then stay with me, because what we need to do now is teach your child to tolerate the feel of spectacles on their face. If your child has hypersensitivity, then we don't need to worry about the spectacles making the world look different, magnification, minification, or distortions around the edges, because your child is not going to open their eyes for long enough to see what the world looks like through their lenses, because your child is going to be acutely distressed as soon as you put the glasses on their face. So what's going to happen is this. Okay? So we want to get your child to the stage where they are actually willing to open their eyes and experience all the other problems of wearing specs. So this is just an adaptation program to allow them to tolerate the feel of the spectacles. So the first thing to do is to find a pair of spectacles that are going to slip on and off really easily, right? Because these specs are going to go on for a second at a time and then come off. So we don't want to be struggling to get the specs on or off. So we don't want curl sides. I've got some examples here. They're my specs, so they're not children's glasses, but curl sides are a big no-no if you've got a reluctant child. The same thing applies to bands designed to keep the child's spectacles on. Don't let anybody tell you, if your child won't wear spectacles, well, just get a band and tie them on, because now you're giving the child something to really fight against. Now, unfortunately, I don't have a small child to hand, but what I do have is my pet lamb called Lollipop, who's going to wear some specs for me. And putting curl sides on is a real issue, because I've got to struggle with them to get them round her ears, and if she wants to throw them off, they're going to pull her ears and be uncomfortable to come off. So you're teaching a child that specs are uncomfortable, so we don't want those. What we want are, I can't believe I've actually worn these in the past. They're the only ones I could find of mine, because I have a drawer full upstairs, which have straight sides. And this is what we want for the initial pair of specs for your hypersensitive child. So Lollipop can have those on. They come off really easily. So comfort is not going to be an issue. Okay, now straight sides, you may be told when you say this is what you want, are going to slip down their nose. That's fine because they're only going to have them on for a second at a time. So we don't need to worry about that. We'll change them for a more secure pair once your child can tolerate them on for long enough to open their eyes and look through them. Okay, it may be to give you a dirty look, but nevertheless, that's what we'll do. So, what we're going to do is find an activity which has your full attention, because we want wearing specs to be an enjoyable experience. We also ideally want something that's going to occupy your child's hands. So, go down a minute, Lollipop. Incy Wincy Spider is really good. Patter cake, anything where you can just manipulate your child's hands for a second to stop them clawing at their spectacles. So we find an activity and we'll pretend it's Incy Wincy Spider. Obviously you're going to be facing your child as opposed to me with her on my lap. It doesn't mean it has to be you. It can be grandma, it can be absolutely anybody. And we're going to play this lovely game of Incy Wincy Spider. Are you ready, Lollipop? Yes, I'm ready. So we will pop your glasses on. Incy Wincy Spider climbed up the spout. Oh, well done, Lollipop. That was such a good girl. Okay, 1 second is all we're going to try. Okay, now, if you think your child will tolerate it twice, then do it twice. If not, put the glasses away and do something else and get them out again tomorrow. All right, but what your child is learning is that having the glasses on is a short experience, no compulsion, and B, is enjoyable because you're making a huge fuss. Okay? Now, the other thing is, if you can, try and anticipate your child snatching their glasses off. We don't ever want your child to get into the habit of snatching their glasses off and throwing them across the room. So if you can, try to work within your child's tolerance, even if it's extremely short. Don't push your child's tolerance. Eventually, we'll get to the stage where your child will tolerate the spectacles for a few seconds, building up gradually, may take weeks, who cares? And then we're ready to move on to stage 2. Here we are at stage 2. So either you've got a child with hypersensitivity and you've worked through tolerance of keeping the spectacles on for a few seconds, or you haven't got a child with hypersensitivity, so you've arrived here directly ready to get your child used to how the world looks through their specs. So what we're going to do now is find an activity where the child has your full attention that is appropriate for the spectacles they're going to wear. Most children with Down syndrome are long-sighted. So for most children with Down syndrome, I will suggest reading a book, but it may be doing a puzzle, whatever floats your child's boat. If your child is short-sighted, then obviously your child can see clearly at near without their glasses. So it will be more like watching a video, looking into the distance, spotting the dog outside on the lawn, spotting Granny coming down the garden path through the window, whatever it is, short activity that the child will learn to appreciate with their glasses on. We're going to keep the activity extremely short. So if it's a book, it's 1 page, 1 picture, maybe 1 word on a flashcard. Pop the glasses on. I apologise that Lollipop's glasses don't fit her very well. In fact, they're a terrible fit. She can't even see through them. Start the activity. Oh, look, a picture of a cow. What does the car say? Moo. Did I say car then rather than cow? Dear, I'm no good as a childminder, am I? Okay, and take the glasses off immediately. Make sure that you take the glasses off for your child until you can trust your child to take them off gently and put them down appropriately. Okay, we're trying to avoid the situation where your child snatches their glasses off and throws them across the room. If they do that, and they probably will on 1 occasion at least, don't react. Simply go to the glasses, pick them up, don't comment, put them away. All right? Don't teach your child to enjoy winding you up by throwing their glasses across the room. It's very easily done. Okay, that's it for today. We've done 1 page or done 1 word, whatever. Tomorrow we'll do it again. So we probably need an activity that the child is happy to do shortly. Don't start a story and not let them finish the story. So think carefully about what activity you're going to use. It doesn't matter what it is. We are trying to teach your child that wearing their spectacles, first of all, is enjoyable because they're doing something they like with you, and something that they can see better or see more comfortably with their glasses on. Okay, so tomorrow it might be a slightly longer time, or it may be a short time this week, a bit longer next week. The week after, it might even be 2 pages of the book or 2 puzzles or whatever. We're building up really, really slowly, because one day it's going to click. One day your child is going to realise that he or she can see better, and the activity is more enjoyable with the glasses on. That's the point we're aiming for. And once you've got to that stage, and it may take months, don't worry, it doesn't matter how long it takes. Once we're at that stage, your child will decide for themselves how long they want to keep their glasses on for, and when they wear their glasses. They'll begin to ask you for their glasses, whether it's with a sign or a word or just their behaviour. You'll know they're asking for their glasses. That's absolutely fine. But let your child decide how long they want to keep their glasses on for. If you give your child control over their spectacle wear, in my experience, the majority of children eventually choose to wear their glasses all the time. But it's very difficult to get them there if you try and push them beyond their natural pace. Some children never want to wear their glasses all the time, and that's absolutely fine. The glasses are going to be important when they're learning, or when they're doing anything close to them, if they're long-sighted, when they're doing something far away, when they're short-sighted, and not at other times. And that's fine. As I've already said, they're not going to come to any harm whatsoever when they're not wearing their spectacles. So don't worry, let your child decide, and if they choose to wear them all the time, fair enough. Some children start to associate their glasses with schoolwork, and they'll wear them in school and not at home. A bit like school uniform. I'm at home now, I'm not working, I'm not going to wear my school uniform, and I'm not going to wear my glasses. That's fine. Go with it. All right? If they take their overcoat off, you don't mind. If they take their glasses off, you don't mind. It's all so easy. And don't let anyone make you feel guilty if your child doesn't wear them all the time, because as we learned in that study, they're normal.